go.
Hi, good morning. It's Dr. Denny over at Positive Fulshire Veterinary Clinic, and today Maddie and I are going to be chatting a little bit about what to expect after your dog has anesthesia. So she's going to start us off by asking some questions, and hopefully this answers questions that you might have and gets you more information.
Dr. Denny, how long does it take for anesthesia to wear off in a dog?
So this is kind of like a twofold question. So it does really depend on sometimes on breed, definitely on age. So I do feel that my younger patients will recover a little bit faster. My older patients do take longer simply because their organs take longer to process through the drugs. We have to remember that as we age, so do our organs, and so it takes longer for things to process through. So that can mean that, maybe your dog is groggy for a few hours. It can mean that maybe your dog is groggy for the rest of the day and the next morning is fine. Or it could mean that it could take a few days. Like on my older patients, I do think it can take a couple days for them to start to feel back to normal. And that's very similar to humans as well.
How soon after anesthesia will my dog be back to normal?
So I think that's a good question, right? So like we just kind of talked about how it really does vary. I would say most patients that are younger, that are not geriatric, usually by the next day we're feeling fairly back to normal. It's also going to depend on what procedure they had, right? So was it like something minor, like did we have to repair a laceration? So it's not like major abdominal or major dental work where we could have some lingering effects from pain. So that plays into part two. So if your dog's older, I would expect for it to take a few days. If your dog had a pretty extensive procedure or a very invasive procedure or a long procedure, then we're going to see it take a few days for them to kind of get back to normal. The good news is if they're not feeling 100%, always, we're always checking in the day after, but if you are concerned, please give us a call and we're going to work with you to make sure that your pet is doing just fine.
How long will it take my dog to recover from anesthesia?
So when we say the word recover, so what in my mind, what that means is the point of how long does it take your dog or my patient to completely wake up and be aware of their surroundings. So that's what I think in my mind what recover means. And that is going to vary. I will say that most of our patients, by the time we turn them off of gas anesthesia and they're just on straight oxygen, most patients within anywhere from 5 to 20 to 30 minutes are going to be completely up and sitting up, and they may be a little groggy. We do send a lot of pictures to our owners that way, like, hey, look, your pet is awake, a little bit groggy, a little bit sleepy, but here we are awake, because I know anesthesia can make everyone very nervous, including myself. When it's time for my pets to go under anesthesia, I know I always have a little bit of anxiety. That's completely normal. But generally recovery, most patients are recovered within an hour, and then we do have a veterinary technician that is sitting with that patient until they are completely awake. So we have very close monitoring here.
What can I expect after I bring my dog home from an anesthetic procedure?
So they're going to be a little bit groggy. They'll be a little off balance, so we really don't want to be doing stairs. We do not want to take them for a long walk. Walking it out is not going to be what we need to do. They need to be quiet. They need to rest. They're going to be sleepy. They may not be hungry that night, even though we do anti-nausea medications, because the anesthesia can cause nausea. Anesthesia can just cut your appetite. So I'm not surprised when my patients don't eat that night. Now, they should be eating the next day. But I'm not surprised if they're not eating. Sometimes if they're super sleepy or if the pain meds are really hitting them and they're definitely feeling it, we can see sometimes a little bit of loss of bladder control, so that's something to be aware of. Some patients will be a little bit more whiny or vocal. I think that's a fairly common side effect. So if you've ever seen those videos of people waking up from their wisdom teeth and they're crying and talking nonsense, and then the next day they're like, I have no idea what I was saying, and they don't remember it. Your pet's going through that too, but we have to remember they can't talk, so they can vocalize, and that vocalization doesn't mean that they're hurting. It kind of is more like they're just trying to wake up and they feel weird, and so that's going to make them vocalize. Sometimes we can also see drooling. They can have icky dog farts. So those are probably going to be the most common things that we can watch for.
How can I help my dog recover from anesthesia at home?
So they need to be kept in a really quiet place, dim lighting, no stairs, no loud noises. We need to make sure that they're on comfortable bedding. We need to make sure they're not on surfaces where they can slip because they are going to be unbalanced. So it's basically, what would you want if you were recovering from a surgery? And that's what we need to kind of go for. So when I've had surgery, I'm pretty much in bed. Like, I just want to be in the quiet. If they need someone sitting with them and that makes them more comfortable, then sit with them. So it's going to be dependent on kind of what your dog needs, but generally a calm, quiet place, no stairs. It needs to be in a kind of an enclosed area. That way they don't stumble into anything, but that's what I would do.
What are signs of complications from anesthesia that I should watch for as my dog recovers?
So your dog should be responsive to you, okay? If your dog is not responsive, meaning you cannot rouse them, they are not aware of you, their eyes aren't open, that you need to bring them back in, okay? They should obviously be breathing, okay? That's a good thing. We want to make sure that their gums are nice and pink, ensuring that, hey, we've got good blood flow. We need to make sure that, they are, even if I'm expecting them to be a little off balance, but we should be able to stand, even if it is with a little bit of assistance. If we're not able to stand at all, even with assistance, then, we probably need to go ahead and reach out and let us know that, hey, Fluffy's having a little bit of hard time waking up. That way we can help you and intervene. But yeah, we need to make sure that they're breathing normally. Like I said about sometimes they'll eat, sometimes they won't. I don't necessarily worry about that night. The next morning we should be eating those. So I think that's kind of your broad strokes there.
When and what should I feed my dog after anesthesia?
So they can definitely have their regular kibble. You can also cook for them just a little bit, just to stir their appetite, boiled chicken and rice. As long as they don't have a chicken allergy, you can do scrambled eggs. But you can offer regular kibble, and you can even soften if they've had like a massive dental procedure and they've had teeth extracted. Then we want to go ahead and make sure that their kibble's been softened with water. But once again, I am not concerned if they don't eat that night. Now, if they're still not eating by the next morning, we need to know about it. So, excuse me, I hope that goes ahead and answers some questions that you may have. If you do have further concerns, or if you feel like your dog is not recovering or waking up from anesthesia correctly and that you're nervous, please give the clinic a call. If we're not open, you can call the veterinary emergency group. That phone number is listed on our website and on our voicemail, but we are here to help. Thanks, guys. Have a good day.